Thanks, Pat, and thanks, Universitas 21, for inviting me to speak. I'm a rheumatologist, and like about a third of the rheumatologists in Ireland, I work in full-time private practice. And like most rheumatologists in Ireland, I work in a relatively small practice. I work in a partnership with one other doctor, and I think there's probably one department in the country that has 4 rheumatologists and maybe a couple that have 3, but they all tend to be quite small. I have been a rheumatologist for about 12 years. I did my undergraduate training for about 6 years and then trained for about 9 years after that. So I spent 15 years getting ready to be a rheumatologist, and then I've got another 30 years, or I've got another 20 years to go now, without necessarily having any structure to continue to educate myself. So although I'm not an expert in education, you all are, I think I'm an expert in educating myself in the way in which I learn, or the way that I've learned to learn. This is a graph put together by Dr. Brian McGowan, who's the author of a book called Social QI. And on the top line, this is a kind of a graph of medical competency. Along the top line is kind of how most people would sort of imagine doctors to be after their postgraduate training. They sort of continue to learn, they remain up to date. Of course, the bottom line there, with a significant drop-off in medical competency, thankfully it doesn't happen too often. But most of us kind of sit in between with the hashed line. And whereas I always saw myself as reasonably diligent attending medical conferences and getting the journals and so on, it's become obvious to me now that I've started learning using social media that I'd kind of slipped off the graph a little bit and had a lot of catching up to do. Part of the problem relates to volume of information. This is just some figures from a primary care study, which suggests that if you're in primary care, in GP, you've got to read 341 active journals to keep up to date, with about 8,000 articles and about 627 hours a month. And that's not really practical. As a rheumatologist, I probably need to keep up to date with 4 to 6 journals, and it's still not possible for me. So part of the problem, if you call it that, relates to volume of information, but I think more significantly it relates to our inability to filter it effectively. So I subscribe to the journals. This is my pile of arthritis and rheumatism. It's the, I think, the most cited rheumatology journal. And you'll notice that half of the journals in the pile still have the plastic cellophane covers on. As I was preparing this slide, I took the cellophane off a few others just to make it look a bit better. But you know, this is a big journal. If I was to sit down and read this every month, I probably wouldn't have time to do anything else. And yet, there's lots of great information in there. So, like everybody else, I subscribe to the table of contents email from the journal. But of course, the emails arrive in the middle of other, more important emails quite often. Sometimes, if I'm feeling well organized, I'll flag the email for later perusal. But of course, that doesn't always happen. I go to a twice annual Irish rheumatology meeting, which is, to be honest, the educational highlight of my year. And this is a group of 5 rheumatologists, including ECD's new chair of rheumatology, Jerry Wilson, is in the background there, trying to work out what's wrong with this man's foot. But what I like about the meeting, and what works for me, is the if you like, the social network that I'm part of, and the way in which we share information together. I also, just to clock up some sort of continual medical education points, attend the twice monthly clinical pathological meeting and sit watching prostate biopsies being discussed by urologists. I have to do it to clock up significant CME points, but as you can imagine, even those of you who don't know much about rheumatology, that prostate biopsies rarely feature. So every year, all of the rheumatologists in Ireland go on our annual pilgrimage to the big American meeting. A colleague of mine commented to see whether anyone would actually notice the difference when we left the country. We usually go to one of the big American cities to what is, I think, a well-organized meeting. The problem for me is that I need to learn. The questions to which I need answers to occur to me every day. And whereas I can sort of, in my mind, stockpile questions I need answered, by the time I get to the annual general meeting in San Diego or whatever, I've usually forgotten the questions I needed answers to. So in that regard, it's sort of a little unsatisfying. Also, this is what I call the Diabolical Trinity of conferences. What's great about them is the social part, of course, but some of that can sometimes take place outside the campus or conference center. The perennial guilt that's associated with conferencing, leaving your colleagues and your wife and your kids behind, or being in a city like San Francisco and visiting the city and feeling guilty about not being at the conference, or being at the conference and feeling guilty about not visiting San Francisco. And it's not conducive to good learning, and of course there's jet lag. So all of these things conspire to, within 2 or 3 days, to see delegates wandering around like zombies, jet-lagged, occasionally sleep-deprived, and even hungover. So that aside, this is the meeting. It is the 2011 meeting, 2,500 abstracts. The book weighs 8 pounds. A colleague of mine who's just retired reminded me that when he started going to this meeting 25 years ago, that he was able to pick up the abstract book, get on the aeroplane, read the abstract book cover to cover, have a glass of wine, watch the in-flight movie, have a nap, and wake up in wherever the American city was. Last year, I picked up the abstract book. I read for 3 hours on the plane. I woke up the next morning at 4 o'clock in the morning, jet-lagged, and I read for another 3 hours. And I got about halfway through day one of a 4-day meeting. And that's not, I mean, I was trying. And yet, of that 2,500 abstracts, 25% of them would be published in peer-reviewed journals. So 75% of them could be lost forever in a PDF file. And this is the work of thousands of researchers. And in there somewhere, there's some nugget of information that's going to change the life of one of my patients or the way in which I practice. And so it's a little unsatisfactory. And I think it again relates to partly the volume of information, but our inability to filter it. That you would be able to filter what looks like an Argos catalogue of information. So again, the whole social network around these meetings helps to filter it a little. Discussions that you have with colleagues on the way to the conference center in the bus, a chat you might have in the bar later on over a beer with a colleague might alert you to some little juicy clinical nugget that may help, and the conversations that take place in corridors and so on. And this, what it effectively does is it allows my colleague to sort of help collate and filter the information for me. And I think in a way, this is what social media does, and I'll come back to it in a little bit more detail. So this is social networks and the power of social networks in terms of spreading information. This top line with the two people in it is me and my colleague Adrian Gibbs, who works in the practice with me. We've been working together for 5 years. I've learned a lot from him. He's learned a lot from me. But after about 5 years, you kind of run out of stuff to say over breakfast. And we both agreed that it was time to move on and see other people. This group of 5, I think, has a little bit more dynamic to it. And there's an old Woody Allen gag where he says, I think, that love between 2 people is an amazing thing, but between 5, it is spectacular. So again, the social network, as it gets bigger, provided you've got the correct people within it, can be enormously valuable. So this is a slide from Stanford, from a project called the Republic of Letters. Now this looks like one of those sort of Twitter visualizations or social media visualizations that you'd see. And this is actually based on correspondences between European intellectuals between 1700 and 1750. And this is this is a kind of a social network in itself. So this sort of thing took place, maybe not at the scale and the rapidity that we have now, way back then. And this is my social network. This is a visualization from LinkedIn. And you'll see, I mean, I'm in the middle there. There's healthcare professionals in it. There's people from the technology industry. There's people from the arts that I'm interested in. There's old college people that I knew and so on. But you can begin to get an idea of the size of that network. There's no way that you could have that sort of network living in Galway, even if you knew everybody. So, I think the thing that is, and I don't want to overstate this, but the thing that has transformed the way in which I learn and has, if you like, reignited an interest for me in medicine that I think I had as a medical student has been Twitter. So it's not all the Kardashians and Kanye West tweeting what they had for their breakfast. This has been an invaluable source of information for me. So this is my Twitter network. In fact, it's probably bigger since I put that slide together. And you can see there's rheumatology. This is a network of rheumatologists all over the world, from the US, Philip Gardner's in Derry, Dave O'Reilly's in England, Erwin Lim's in Australia, Jose's in Madrid, Suleiman's in New Jersey, Francis is in Paris, and so on. This is a mix of people who work in full-time private practice, academic rheumatologists, clinical rheumatologists, and so on. And all day, every day, we share information with one another. So that network of people, if you like, collates and gathers all of the relevant information from the journals that they have read or the parts of the journals that they have read and shares it with their colleagues. So this is, I don't know how many in the audience are Twitter users. You want to put up your hands? It's a bit more than usual, but yeah, okay. So you can see, I mean, the tweets are about 140 characters long, but you can put in a link to a paper or a link to anything, to a photograph, or, and you can share them and discuss them. There is, this is the dashboard of a Twitter client called Hootsuite. And you'll see if you look at along there, the middle column there, it's rheumatologists. So all my rheumatologists are tweeting stuff all day. I'm interested in things outside medicine. So I subscribe to information about science, about literature, the arts. So if you like, my medical information is sneaked into my subconscious while I'm perusing information from the New York Times. And it's sort of a spoonful of sugar helps the medicine go down, if you like. This is the first conference that I live tweeted at was the American College of Rheumatology in 2011. That's me there in the middle. And the Mayo Clinic, you see, is my little circle was bigger than the Mayo Clinics before they arrived on the campus. But you can see when I share information, the breadth and of the network and who I can share that information with. So I didn't attend the American meeting last year. I wrote a blog about it, about attending a medical meeting in my dressing gown, where my colleagues live tweeted the meeting for me. And I was able to, so for example, this osteoporosis review course, the first tweet there from Suleiman has actually got the slides for the presentation, and he's actually summarized it very well in 4 tweets. So there's something about Twitter and the fact that it's quite abbreviated that makes you, in a kind of a journalistic fashion, sort of condense it down to its pithy core with the awareness that everybody else is watching. It's not the same as being there, but I learned a lot more from the American College of Rheumatology last year by not attending than I did the year before that I attended. So I set up a hashtag, which is, if you like, a place for anybody who's interested in rheumatology, which includes doctors, patients, to go and we post links. So for example, I have a colleague in Germany who tweets lots of interesting rheumatology, but also tweets haiku and photographs and so on. And there are times of the day I don't necessarily want to look at that, and I'll just look at that hashtag. So any of you are familiar with Google Circles? We've set up what's called a Google community. I think we've got 25 rheumatologists on it at the moment from all over the world. And again, Twitter is open. you need to be a little bit careful about what you post on it because the whole world looks at it. And this is a closed Google Circle, which is sort of invite only, which is basically rheumatologists and rheumatology trainees. And we share references and cases. And this is a case of a tricky patient that I saw in clinic. If you like, a very rare presentation of a very common medical disorder called polymyalgia rheumatica. And I'd never seen it present in this way before, and I got the MRI scans and blood tests. We posted them on in the community, and I got about 65 different comments from 15 different rheumatologists on how ideally to manage this, with links to references and so on. The great bit at the end was that my Dutch colleague sent me a reference to a publication by a colleague of mine, Sinead Harney in Cork, who'd seen an identical patient. So I was able to ring her up, but as my wife said, why didn't you just ring her in the first place? But I wouldn't have known to. So there's Twitter. We use Google Circles. And who's familiar with RSS feeds? I would have thought you lot should. Who uses them? Yeah. Okay, all right. So I mean, an RSS feed is basically a way in where websites share content. So it sort of provides an information feed that can be reproduced in lots of different formats. So there's a platform which is free called Feedly. And what it does, it allows you to collect in the one place web feeds from all of your favorite websites. So rather than going to the Lancet site and to the New England Journal of Medicine site and so on, it allows you to sort of collect them all together. So I have some stuff from rheumatology journals, I have stuff from the sort of trade press and so on, but also health information from the lay press, from New York Times and The Guardian and so on, and medical bloggers as well that I'm interested in. So this is a kind of a sort of a screenshot of what Feedly looks like. So these are the references. You can click on them, you can open them up, and obviously if you have online access, you can link into the original article. And also you can share them directly on Twitter or whatever platform you want to use. So these are some of the different feeders that I have messed around with. They're a lot easier to use than Google Reader in the old days. I think, to be honest, my favorite at the moment is probably NewsBlur. It's a nice clean interface. And all you need is the website address of the journal to find the feed for it. I'm interested in a lot of stuff outside medicine, so I tend to use those sort of more open platforms. But something I've been recommending to clinical colleagues recently is a new platform called DocWise. And again, this is free. It's available for iPad and for iPhone. And basically, you log in, you put in your sort of specialty details and so on. And you can choose your specialty from a list. And then what they do is they show you all the relevant journals for that specialty. And you simply click on the relevant link, and then if you like, they're in your feed. So you don't need to know anything about it or RSS feeds. This allows you to collate them. So any of you who use Flipboard on an iPad, you're able to sort of scroll across the screen quite easily like this. You can simply click with your finger on the link to open it up. And if you want to read the entire article, and if you have a subscription, I have a subscription with RCSI, and basically it links directly into the original paper. And you can save them and collect them and build up a sort of a library for yourself and so on. And also you can share references by email, on Twitter, and they're putting in a link for Evernote if you use that. So I'm interested in what other clinicians think. I think certainly there's an important place for what academia think about clinical practice and so on. But the people I really want information from, the people that are most relevant to me, are people who do similar things to me. I think if you're interested in healthcare, I think it's important to read outside the medical journals. And these are a few of the different blogs that I subscribe to. I think my favorite is by a pediatric gastroenterology from Texas called Brian Vartabedian. It's probably the biggest followed physician blog in the US. It's called 33 Charts. So I would suggest, if you're interested in medical education and the future of medicine, where it interfaces with technology, Brian Vartabedian is. And he's coming over to speak at a meeting in Dublin in December that I'm running called TEDMED. I also write, and I learn by writing as well. I think any of you who write either for scientific journals or otherwise, it sort of focuses the mind and challenges the perhaps assumptions that you might have had and generates discussion online. So I write for my patients, I write for my colleagues, and I do it because I enjoy it. So with all this information coming at you from Twitter, from RSS feeds, from Google Reader and so on, how do you save it all? I mean, you can save it on a notepad, or if you're really cool, you can write it in a little moleskin notepad. But I use Evernote. It's free, and it's a platform that allows you to save notes in the forms of text, audio messages, pictures of slides directly into it. It allows you to index them, search them, and of course share them on social media platforms. I use it on my iPad, I use it on my laptop, and I use it on my computer at home. I know that there are lots of different reference managers. I'm sure you're more familiar with them than I am. I tend to use Mendeley because that's where all my information has been dumped in the last few years. And it's a great way of collecting all your PDFs and being able to search them and so on. There is a social element to this you can share with other physicians. I haven't done that yet. So, in terms of my inbound information, RSS feeds, Twitter, Google Circles, blogs, and obviously sometimes you've got to dig deep and read the full article. This is also the way in which I broadcast and share information. So what's coming next? I don't know. I'm not absolutely sure. But I think a lot of clinicians I know are very nervous about open social platforms like Twitter and Facebook and so on. I think they're afraid they're going to be hounded by patients, which I'm not. But there are two platforms, one of which has got definite plans to come to Europe. One is called Thermo, and the other is Doximity. And these are physician-only platforms. They're locked down. You need to be a doctor to get in. And it will allow you to share clinical information, to answer surveys, and to contact your colleagues all over the world. This is a screenshot of Doximity. This is the one I'd like to see coming to Ireland, I think, from my colleague Paul Sufka, who's one of my Twitter buddies. So you can see it's a bit like LinkedIn or sort of Facebook for doctors. I was lucky enough to go to TEDMED, which is a spin-off of the TED series of meetings about 2 years ago in Washington. For anybody who's sort of even remotely interested in healthcare, if you can get somebody to pay you to go, go. It's an amazing meeting. But last year, I attended TEDMED in Galway, and an enterprising medical student in the university there contacted TEDMED because they have this digital broadcast. So in the same way that you might go and see the New York Met on digital broadcast in your local cinema, you can now see something like TEDMED Live. They don't make a charge for academic institutions. And we had an amazing meeting last year. We condensed it down to 1 day instead of 3. We had 4 local, really good speakers, and then a few from the TEDMED conference. So what it allows you to do is to sort of broadcast the meeting into another venue and build up your sort of network and platform around that, rather than us all sitting in our dressing gowns in our bedrooms watching the conference. This is the big American radiology meeting. I think there's like 50,000 delegates at it. Last year, you could attend 60 presentations live, get continuing medical education points. You could do it all online. So this isn't just the videos of the talks after the event. You can sit, you can watch it, you can ask questions of the speakers as you would if you were there. And I think this is going to be, having spoken to some of the academic organisers for the big meetings and so on, I think this is the way things are going to go. And bearing in mind that at the moment, or for the last few years, it has been possible for physicians to travel to big international meetings, really with support from the pharmaceutical industry. I think that's going to come to an end. And I think when we have to pay for these things ourselves, I think it's going to make us look very, very hard at what the educational value of these meetings are. This is me just about to do a presentation to 50 GPs from my office in Galway. So we kind of do these lunchtime web streams so people don't have to leave their offices. So little pockets of GPs all around the country. And it saves me travelling down to Killaloe on a Wednesday evening at 8:30 or whatever. So that's a sort of a, if you like, a thumbnail sketch of what I do. I am very happy to answer any questions anybody has, perhaps in the panel session afterwards. Yeah. So thanks very much for your attention. And